This is just a quick lecture, a little bit about medical documentation. What is their purpose and what types of information are found in a medical record? There are many purposes for good medical documentation. For one, medical records are a means of communication between healthcare providers about a patient. From labs to doctors to pharmacists, ideally the medical record is a central location for all information regarding a patient. It is also the source of information for medical assessment. It contains the history, symptoms, vital signs, etc. that are the clues needed to solve the mystery of what is ailing a patient. Good medical documentation ensures quality care of patients. Hospitals and practices occasionally go through a healthcare audit or random review of patient records by a committee to determine if the patients received the correct diagnoses and treatments. Medical documentation provides verification of care given so that providers can be reimbursed for services. It's also important to note that patient records are legal documents. They are admissible as evidence in court proceedings and might be needed when patients make accident or injury claims or when doctors are charged with improper care or malpractice. Another important purpose for medical records is education. They can be used as case studies to help train new physicians. Morbidity and mortality conferences are held regularly at hospitals and involve peer review of cases that had poor outcomes in an effort to learn from past mistakes in order to improve patient care. Lastly, medical records can be used for research purposes. Data can be collected and mined to find correlations that help to determine effectiveness of therapies or identify contributing factors to diseases. The days of paper-based medical records are coming to an end as we shift to electronic medical records. There are a lot of advantages to the EMR, including ease of access to data. Multiple users in different locations can view the records simultaneously and instantly without needing a fax or photocopier. It's easier storage and retrieval. You can type in a name and pull up a file instantly without needing to physically search for it, and there's no need to return the file to the correct location on a shelf. There's nearly unlimited file space, which saves space in facilities. There's more room for an extra office or an extra exam room. It's easy to back up for security purposes. It's easy to add or attach information in an electronic record. There's improved legibility and charting. Doctors are notorious for having poor handwriting. And it's faster recording of data. Many people can type faster than they can write, and some program features have drop-down menus for faster input. One concern with electronic medical records is security. Protecting patient confidentiality is a top priority in healthcare. The guidelines for safe computer record keeping are: don't share personal passwords or a computer signature. Do not leave computer terminals unattended when you're logged in and people could see private information. Don't leave patient information displayed on a monitor in view of others. Allow only authorized personnel to create, change, or delete records. Backup records regularly so they are not lost, and never use unencrypted email to send protected health information. What types of information are found in a patient's medical record? Well, some things include an admission sheet, which is basic patient data that's gathered before the first visit with a provider, usually a sort of survey that you fill out in the waiting room about your demographic and insurance information, including copies of your health insurance card. It'll also include patient medical history. This includes the patient history, which are things like allergies, immunizations, childhood diseases, current and past medications, surgeries, and hospitalizations. There's family history, or your family history of familial diseases like heart disease, cancer, etc., since they often run in families. A social history, including marital status, occupation, education, hobbies, diet, alcohol and tobacco use, and sexual history. Lifestyle may affect illness, but also illness may affect lifestyle. A graphic sheet is a history of vital signs and the dates they were taken. On every visit to your primary care provider, they take your blood pressure, temperature, weight, etc. They keep a record, often in the form of a graph, that shows change over time and can alert the provider if there's a significant change or a concerning trend. You may be accustomed to getting a copy of your child's growth chart at a pediatric visit. This is a type of graphic sheet. Another item are physician's orders. That includes orders for medications, treatments, tests, and follow-up care. And additionally, there are progress notes, or recorded notes from each time the provider has contact with the patient, including in-person, phone, mail, or email communication. Furthermore, there are exam sheets, which are results from the physical examination that the doctor performs. There will also be various reports, blood test results, EKGs, X-rays, CT scans, etc. There's also some other miscellaneous documentation that can be found in the medical record, including signed consent forms and instructions regarding end-of-life decisions, such as organ donation and living will. The characteristics of good medical documentation are accuracy, only report the facts, not opinions. Completeness, make sure to record both normal and abnormal findings. Conciseness, only include relevant information and do not use excessively wordy language. It just takes people longer to read it. Legibility, with electronic medical records, this is less of a problem, but in handwritten forms, they need to be neat and legible to avoid mistakes or miscalculations. When it comes to progress notes, there are 3 different types or styles for recording these. One type is narrative notes. Another, SOAP notes is what they're called, and the third form is charting by exception. No matter which type of progress notes you keep, it is always imperative that you record the date and the time and include your signature and credentials by each entry. Narrative notes are written in paragraph form. They are the oldest and least structured type of progress notes, and they're more time-consuming both to write and to read, but they're very detailed and provide a lot of information. A more popular and efficient note-taking technique is to use the SOAP method, or SOAP, standing for Subjective, Objective, Assessment, and Plan. The S, subjective impressions, are information that are provided by the patient, usually in their own words. The objective impressions, O, are information that are provided by healthcare professionals, including a list of measurable and reproducible data, things like vital signs or height and weight or lab results, and can be provided by the nurse or doctor or other healthcare professional performing a diagnostic test. A, assessment, is the interpretation of the subjective and objective findings, or in other words, the medical diagnosis by the provider. And lastly, P, plan, is the provider's plan for treating the disease or for follow-up tests that need to be done or follow-up treatments. A third type of progress notes is charting by exception. In this technique, one only records significant or abnormal findings in a patient. It decreases charting time and it puts a greater emphasis on data that is significant rather than normal findings. It's a better way of tracking important patient responses.